In this series of videos, I want to talk about digital photography in a way that we can quickly review the salient things that we need to be thinking about to get consistent photography into our practice. We've been talking about treatment planning for a very long time at the Dawson Academy, and since probably about 2004, 2005, when digital photography really became available, that's when we really started utilizing it more and more, not just to document what we do, but to get crystal clear on understanding that we can use pictures to relate important information back to the models to make decisions about where the teeth need to reside in space. So having said that, having spent several hundreds of hours, I bet, talking to our students about photography, we still see inconsistencies with pictures from our doctors. And it might be an exposure problem where some of the pictures are just too bright or too dark. But many times the pictures are related to, when we look at them, there are cants with the smile, cants with the patient's head. The heads might be tipped too far back so it looks like the patient has a reverse curve to their smile. And so what we have to remember when we're taking good pictures is that we have to think about the camera settings on each specific shot, and we have to think about how we're going to position the patient and how we're going to position the photographer. And if you think about those three things in the course of what we're doing, we can get very consistent about taking these pictures so we get it right every time. I'm the first to admit that I've been a bit of a camera snob over the years and have been a big believer that digital SLRs were the way to go, that you needed to have a very high-end digital slow reflex type camera with a true macro flash and a true macro lens unit. And again, this is one way. If you're on the track where you need to shoot raw, for instance, if you're doing the American Academy of Cosmetic Dentistry accreditation thing, you're going to need a camera like that. But if you're a doctor that is trying to just get routine pictures, consistent routine pictures within your practice, it's not as necessary today, and I'll talk about some of these newer cameras in a second. The biggest problem with digital SLRs, as I've seen it over time, is that there are very specific settings that need to be programmed into these cameras that have to stay in that position every single time. And what I see a lot is somebody will pick up the camera, make some alteration to it, and then all of a sudden it might be that you change from an aperture priority mode to a manual mode, or it may be that the internal setting that you have to check off that syncs the flash to the f-stop, or to the shutter speed rather, that gets off. Whatever the reason, if any of these things happen, all of a sudden the camera goes awry and you get crazy exposures that can get very frustrating to the doctor and the team. So with that, I've been looking for a long time for a camera that could be used specifically for dentistry. And Shofu has come up with the Special Eye camera that is basically a point and shoot type camera that's been built specifically for dentistry. And we'll talk about the settings of this camera and how easy it is as we go through this video series. But again, some of the benefits of it is because this is a medical grade type product, it is extremely easy to wipe this camera down at the end of the use. Whereas with these type of cameras, we're consistently concerned with all the little areas that are hard to clean, that if you get saliva on it, it's one of those things that can be a potential problem. And let's be honest, when we're taking intraoral shots with mirrors and things, you're going to have gloves on, and you're going to get some fluids on these things. So I love that aspect of it. The other aspect of about it is it's designed specifically for shooting for what we need to do. So on the back of this, you're going to see very specific modes with the touch screen that we're going to go to focus on the full face. There's a standard setting that allows us to take the smiles and the standard retracted pictures that we take. There's a specific setting for the mirror. There's a specific setting for taking shades so we can get a color-corrected image that's going to be accurate for our lab technicians every time. So again, I think for those of you that are maybe in the market for looking for a camera. And specifically if you're going to be a doctor that wants your team to take most of the pictures, which I highly recommend you do that, this may be a very good option for you. The other thing we hear from team members is that these cameras are just too heavy. And if the digital SLRs are too heavy, then often what happens is, for instance, if they're taking an occlusal shot, they're going to need somebody to hold the mirror so they can support the camera. What I like about this is it's so nice and light that you can have the patient retracting the lips away from the teeth, as we'll demonstrate in a minute, and then very easily your staff person can control the mirror and the camera and take a good picture every time. So as we go through, you're going to see the ease of this camera, how easily we can get really, really good consistent pictures. But the other thing that I want you to focus beyond the camera is how important it is for you to be thinking about how you're going to position the patient and how you're going to position the photographer on each and every shot. When pictures start to get bad in a practice, we can almost always orient it either to a bad camera setting, which again can't happen with this camera, but by most of the time what we're also seeing is an assistant or a doctor rushing where they're trying to take the picture with the patient laying back in the chair. So follow the instructions in this video. We've arranged it so you can go very specifically to the shots that we're going to take in our series, and I think that you'll have some good consistency. The last thing I would just recommend is to go ahead and print out our job aid that we've made for you. When you're training your team, this is a cumbersome, stressful thing. They're not used to this. It's a new skill. And a job aid like this that has the pictures that we're going to take in our 21 shots in the Dawson Academy series, along with the tips on each picture on the back that basically walks them through what they're going to be utilizing if they're using the Shofu camera or if they're using a digital SLR. Having a job aid like this is really invaluable. And in that way, just like a full mouth series, as they take each picture, they can kind of check it off and they'll get a good picture every single time. So with that, I wish you luck. This eye view is an extremely important part of what we do. I just couldn't do the dentistry at the level that I do it if I didn't have good clinical pictures to look at in the treatment planning phase. But also, make no mistake, a high healthy case acceptance rate is also completely related to having good pictures so patients can see what their teeth really look like. And as you start finishing cases that are beautiful, you're going to start building a reservoir of cases where you have good before and after, good consistent before and after pictures that you can show other prospective patients. And again, I just find it so amazing that today's patients are becoming so clinically aware, and they want to see proof of what you're doing before they sign up for treatment with you. So good luck with this series, and I hope you enjoy it.